Hello, everyone. Welcome to Backyard Musings. Broadcasting. I'm broadcasting from Ontario. Still, I'm at the dealership.
Spent the night down there, did you?
You know, we broadcast back to back, so we don't have to meet up at
They,
the
they got
crack of
great
dawn.
accommodations there. Looks like you're in a cell.
I sleep under the table in the fetal position.
It's what perks of having an electric car, I guess. So,
Yeah, I'm Steve, and the other guy here, he's our color commentary. That's Scott. We're
spot
happy to be with you, and thank you for joining. Thank you very much.
yeah,
We hope
thank you.
that you find we hope that you find these segments informative, and if you do, click the subscribe button. But tell your families, tell your friends, and tell your enemies, hey, this is interesting stuff that Scott and Steve are spewing out. Right?
I'm eternally grateful for the research team. Let me just throw that in. The research
This is
team
our
does an number one job, I'll tell you.
this is our 1 year anniversary, folks. Our 1 year anniversary is today. We came on a year ago today.
Yeah, I'll always remember it because it's my wife's birthday as well. So,
Happy birthday.
yeah.
All right, here we go. The melding of visual information, microscopic and X ray images, CT scans, and MRI scans, for example, with text, as in exam notes, communications between physicians of varying specialties, is a key component of cancer care. So we'll go over that again. Visual information, the microscopic, the X ray, the CT, the MRI, along with notes and talking with the doctors and stuff, key components. That all leads to the diagnosis and the facilitation, the destruction of that cancer. But while artificial intelligence helps doctors review images and home in on disease associated anomalies like abnormally shaped cells, it's been difficult to develop computerized models that can incorporate multiple types of data. Researchers at Stanford Medicine have now developed an AI model able to incorporate visual and language based information. And of course, this has to be supervised. You just can't let it, put it on cruise control and let it go. A medical doctor really needs to review this and make sure that it's right. We're talking about people's lives. Would you like to know more?
And a couple of those things, I think to me, it's kind of really cool that some of these information getting things are like MRIs. That's a fairly new way of research, right? Even
Yeah.
CT is kind of new. So, and they're coming a long way with this stuff. So it's really cool.
Yeah.
But I'm hoping in my lifetime that they are able to find some kind of cure for this stuff, because cancer is just it's nasty.
Yeah, it is.
So after training on 50 million medical images of standard pathology slides and more than 1 billion pathology related texts, the model outperformed standard methods in its ability to predict the prognosis of thousands of people with diverse types of cancer, to identify which people with lung or gastro, I should know this one because I know somebody that
Esophageal.
gastro, say that again.
Esophageal.
Esophageal. You know somebody that's had this as well.
I have gastro problems. My wife always tells me I do.
Yeah, well, when we're off the call, I'll tell you who it is. So, and those are cancers likely to benefit from immunotherapy, and to pinpoint people with a melanoma who are most likely to experience a recurrence of their cancer.
So the researchers named the model MUSK. That's MUSK, and it's for multimodal transformer with unified mask modeling. MUSK represents a marked deviation from the way artificial intelligence is currently used in clinical care settings, and the researchers believe it stands to transform how artificial intelligence can guide patient care.
Quote, Musk can accurately predict the prognosis of people with many different kinds and stages of cancer, said Rujang Lai, MD, an associate professor of radiation oncology again, according to Dr. Lai, we designed MUSK because in clinical practice, physicians never rely on just one type of data to make clinical decisions. We wanted to leverage multiple types of data to gain more insight and get more precise predictions about patient outcomes, unquote.
So Lee, who is a member of the Stanford Cancer Institute, is the senior author of the study, which was published January 8th in Nature. Postdoctoral scholars Jinji Zhang, a PhD, and Zhihui Wang, a PhD, are the lead authors of the research. Although artificial intelligence tools have been increasingly used in the clinic, they have been primarily for diagnostics. Does this microscope image or scan show signs of cancer? Something that maybe because the doctor is fatigued, been looking at these all day, misses it or whatever, the AI can pick it up. Rather than for prognosis, what is this person's likely clinical outcome and which therapy is most effective for an individual?
Part of the challenge is the need to train the models on large amounts of labeled data. This is a microscope slide of a slice of lung tissue with a cancerous tumor, for example. That's up?
Well, I don't have that up on the screen, but that's what they're talking about.
We don't. Okay. And paired data. Here are the clinical notes about the patient from whom the tumor was obtained, but carefully curated and annotated data sets are hard to come by.
Right, that takes experience, the residency and the experience. In artificial intelligence terms, MUSK is what's called a foundation model. Foundation models pre-trained on vast amounts of data can be customized with additional training to perform specific tasks. Because the researchers designed MUSK to use unpaired multimodal data that doesn't meet the traditional requirements for training artificial intelligence, the pool of data that the computer can use to learn during its initial training is expanded by several orders of magnitude. Computers can handle that kind of magnitude. With this head start and subsequent training is accomplished with much smaller, more specialized sets of data. In effect, MUSK is an off-the-shelf tool that doctors can fine-tune to help answer specific clinical questions.
Okay, this is a quote. The biggest unmet clinical need is for models that physicians can use to guide patient treatment, Lai said. Does this patient need this drug, or should we instead focus on another type of therapy? Currently, physicians use information like disease staging and specific genes or proteins to make these decisions, but that's not always accurate, unquote.
It depends on the skill of the physician too. You know, how much experience they have under the belt dealing with this and passing that on to the next doctor. Yeah. The researchers collected microscopic slides of tissue sections, the associated pathology reports and follow-up data, including how the patients fared, from the national database, the Cancer Genome Atlas, for people with 16 major types of cancer, including breast, lung, colorectal, pancreas, kidney, bladder, head, and neck. They used the information to train MUSK to predict disease-specific survival, or the percentage of people who have not died from a specific disease during a defined time period.
For all cancer types, MUSK accurately predicted the disease-specific survival of a patient 75% of the time. That's pretty good.
Yeah.
In contrast, standard predictions based on a person's cancer stage and other clinical risk factors were correct 64% of the time. That's a pretty good number too.
So it's incrementally improving, which is good. You always want to improve. So now maybe with these doctors at 75%, they can inch it up to 80, with the AI. Just incrementally over time, the more data they get. Okay, in another example, the researchers trained MUSK to use thousands of bits of information to predict which patients with cancers of the lung or of the gastric and esophageal tracts are most likely to benefit from immunotherapy. For non-small cell lung cancer, MUSK correctly identified patients who benefited from immunotherapy treatment about 77% of the time. In contrast, the standard method of predicting immunotherapy response based on PDL1 expression was correct only about 61% of the time. That's great.
Yeah, this is a feel good story here.
Yeah.
Similar results were obtained when the researchers trained mice to identify which people with melanoma were most likely to relapse within 5 years after their initial treatment. In this case, the model was correct about 83% of the time, which is about 12% more accurate than the predictions generated by other foundation models. So, yeah, those are really cool numbers.
Astounding statistics.
Yeah.
Yeah. So, and it's just going to get better over time. Quantum computing, faster computing, more information. It'll get better. And then machines will know how to effectively kill us. They will know how to do that.
Well, let's hope that's not in our lifetime.
Right.
I don't want anybody's lifetime, actually. So.
Right. We don't want that. We don't want Terminators.
Always got to be a way to turn the machine off. So, but
let's just hope they don't get self-aware.
Exactly. So,
all right, folks. Thanks for joining us. The festivities will continue this afternoon with our 1-year anniversary and Scott's wife's birthday, commemoration of her birthday. So please stay with us this afternoon. Thank you very much.
All right. Take care, everyone. Thanks.